Hello everyone, welcome back to my channel. So all are eagerly waiting for ESIC UPSC key paper. So here are some questions with answers. So in case if you find any wrong answer, you can comment, or if you find anything useful, please subscribe this channel. So let us see. During resuscitation, which one of the following medications is indicated initially if the heart rate of a newborn continues to be less than 60 per minute after 30 seconds of positive pressure ventilation and chest compression? Options: epinephrine, sodium bicarbonate, atropine, dexamethasone. And the answer is epinephrine. Which one of the following tools maintained by teacher is very valuable for assessment of students' performance? Incident record, anecdotal record, self-report, clinical attendance. And the answer is anecdotal record. A chart indicating the distribution of questions based on objectives and content area is called question paper, blueprint, question bank, checklist. And the answer is blueprint. Period of practical experience and training in clinical nursing supervised by an expert of a particular field is known as preceptorship, mentorship, peer group support, self-reflection. And the answer is preceptorship, it is not mentorship. Okay. The overall plan of rotation of all students in educational institution, including teaching, learning activities and related events during academic year. Clinical rotation plan, master rotation plan, curriculum planning, course plan. So it is master rotation plan. Which one of the following educational philosophies emphasizes practical utility and activity-based curriculum? A. Pragmatism, B. Idealism, C. Realism, D. Naturalism. And the answer is pragmatism. Which one of the following method is best for psychomotor skill development among students? Lecture method, role play, demonstration, group discussion. And the answer is role play. The type of teaching method used for developing teaching skills and competences in teacher trainee is micro teaching, seminar, lecture, group discussion. And the answer is micro teaching. All of the following are the potential circulatory problems after surgery except thrombophlebitis, embolus, hemorrhage, tympanitis. And the answer is tympanitis. In wound healing, the phase where fibroblasts migrate into the wound and begin to synthesize collagen is called inflammatory phase, maturation phase, proliferation phase and evisceration. So the answer is proliferation phase. All are the examination methods for assessment of eyes except tonometry, slit lamp test, refraction test, Romberg test. And the answer is Romberg test. Bell's palsy is an acute, usually temporary condition damage or trauma of resulting from cranial nerve 3, cranial nerve 4, cranial nerve 5, cranial nerve 7. And the answer is cranial nerve 7. Which one of the following markers begin to rise about 6 hours after myocardial infarction and peaks in 18 hours? CKMB, cardiac specific troponin T, myoglobin, cardiac specific troponin I. And the answer is CKMB. A nurse is assessing stoma before changing the colostomy bag. Which one of the following color of stoma indicates ischemia? Rose pink, brown black, dusky blue, bright red. And the answer is dusky blue. Which one of the following is not a surgical therapy in case of Meniere's disease? Stapedotomy, labyrinthectomy, endolymphatic shunt, vestibular nerve section. And the answer is stapedotomy. For adults, the ratio of chest compression to ventilation in case of single rescuer CPR is 15:2, 15:1, 30:2, 30:1. And the answer is 30:2. Wound caused by an injury with a blunt object leading to tearing of soft tissue is known as laceration, abrasions, punctures, incision. And the answer is laceration. In normal range of motion, movement of extremity away from midline of the body is termed as adduction, eversion, inversion, abduction. And the answer is abduction. Which one of the following breathing patterns indicates rhythm abnormality? Dyspnea, Cheney-Stokes breathing, bradypnea, hyperventilation. And the answer is Cheney-Stokes breathing. Which one of the following levels of illness prevention includes actions and measures that inhibit the emergence of risk factors? Secondary prevention, primordial prevention, primary prevention, tertiary prevention. And the answer is primordial prevention. Transverse depressions in nails indicating temporary disturbance of nail growth are known as koilonychia, paronychia, clubbing, Bue's lines. And the answer is Bue's lines. Which of the following are adventitious breath sounds on auscultation? Crackles, ronchi, wheeze, pleural, friction rub. In options it was given whether it is 1 and 2, 1 and 3 or 2 and 3, 1, 2, 3, 4. And the answer is all the sounds. Crackles, ronchi, wheeze, pleural, friction rub. All 4 options. Presence and growth of microorganisms within a host but without tissue invasion or damage is known as infestation, inflammation, colonization, infection. And the answer is colonization. Which of the following biomedical waste should be discarded in yellow color waste bin? Human anatomical waste, Eurobag, needles, soiled plaster casts, glass sides. So in this code 1 and 2, 1 and 4, 2 and 3, 3 and 5. And the answer is 1 and 4, that is human anatomical waste and soiled plaster casts. Flat and painless thickened portion of epidermis consisting of mass of horny keratotic cells formed by local pressure or friction found palm or undersurface of the foot is called plantar warts, corns, athlete's boots and callus. And the answer is corns. Which one of the following are critical thinking skills relates to monitoring and correcting mistakes occurring in processing of interpreting, analyzing, inferring, evaluating or explaining? Analysis, interpretation, self-regulation, explanation. In this I kept answer as analysis, but it is self-regulation. Sleepwalking and enuresis occur in which stage of sleep cycle? Rapid eye movement sleep, non-rapid eye movement sleep stage 1, non-rapid eye movement sleep stage 2, non-rapid eye movement sleep stage 4. And the answer is sleepwalking. Enuresis actually separately if we see, it occurs in sleepwalking in sleep stage 3, whereas enuresis sleep stage 4 or 2. But here answer is, it is 3 is not given, so someone has given answer as NERM sleep stage 4. So we'll wait for the key. Which one of the following neurotransmitters have inhibitory effect on pain? Substance P, endorphins, bradykinin, prostaglandins. And the answer is endorphins. Low arterial concentrations of oxygen in blood is termed as hypoxemia, hypoxia, eupnea, eucapnia. And the answer is hypoxemia. Which one of the following is a physiologically hypertonic solution? 3% sodium chloride, 0.9% sodium chloride, 0.45 sodium chloride, 2.5 dextrose solution. And the answer is 3% sodium chloride. Vascular skin lesions which are benign tumor consisting of blood and lymph vessels are called purpura, Osler's nodes, ecchymosis, angioma. And the answer is angioma. The definite symptoms of acute angle closure glaucoma include severe eye pain, blurred vision, seeing colored halos around lights and ocular redness, tunnel vision, loss of peripheral vision with no pain in and around the eye, severe eye pain, tunnel vision, loss of peripheral vision. Fourth option, no eye pain, ocular redness, tunnel vision. And the answer is severe eye pain, blurred vision, seeing colored halos around lights and ocular redness. Which one of the following is a pre-renal cause of acute kidney injury? Immunological process, toxins, shock, urinary stricture. And the answer is urinary stricture. Which one of the following is most appropriate for pain assessment in patients with chronic pain? Multidimensional questionnaire, FACES scale, visual analog scale, verbal descriptor scale. And the answer is visual analog scale. All of the following are non-steroidal anti-inflammatory drugs except naproxen, indomethacin, allopurinol, diclofenac sodium. And the answer is allopurinol. Which one of the following is a generalized disorder of connective tissue characterized by hardening and thickening of skin, blood vessels, skeletal muscles and internal organs? Systemic lupus erythematosus, systemic sclerosis, gout, psoriasis. And the answer is systemic lupus erythematosus. Which one of the following diagnostic test is used to measure the electrical activity of brain cells? Computed tomography, electroneurography, electroencephalography, electromyography. And the answer is electroencephalography. All of the following are exclusion criteria for tissue plasminogen activator therapy except glucose level more than 400 mg per dl, coagulopathy, history of major surgery in the past 2 weeks, ischemic stroke. And the answer is history of major surgery in the past 2 weeks. Which one of the following drugs stabilize the cardiac membrane in a patient with hyperkalemia? Sodium bicarbonate, insulin, calcium gluconate, digoxin. And the answer is calcium gluconate. Which one of the following hormone is secreted by neurohypophysis that causes uterine contractions? Estrogen, progesterone, prolactin, oxytocin. And the answer is oxytocin. Which one of the following plasma proteins has the function of maintaining osmotic pressure? Haptoglobin, transferrin, albumin, ceruloplasmin. And the answer is albumin. IQ score of 90 is classified as borderline, average, superior, bright normal. And the answer is bright normal. According to Sigmund Freud's theory of psychoanalysis, all of the following are structures of personality except conscious, id, ego, superego. And the answer is conscious. The conflict that occurs due to having to choose between two positive goals which are equally attractive at the same time is called approach avoidance conflict, double approach avoidance conflict, avoidance conflict, approach conflict. And the answer is approach conflict. The type of family in which father has highest status in family who controls the social life of family is called patriarchal family, matriarchal family, patrilocal family, patrilineal family. And the answer is patriarchal family. All of the following are theories of motivation except self-determination theory, Hull's theory, psychoanalytical theory, Sternberg's triarchic theory. And the answer is psychoanalytical theory. The highest level of growth needs as per the Maslow's hierarchy of needs theory is aesthetic, cognitive, esteem, self-actualization. And the answer is self-actualization. Which one of the following is the major immunoglobulin in human serum? IgA, IgD, IgG, IgE. And the answer is IgG. Which one of the following is not a component of epidemiological trait? Environment, agent, host, disease. And the answer is disease. Which one of the following color codes is not correct for triage system adopted in triage of disaster management in India? Red indicates high priority treatment, Yellow indicates medium care priority. Blue indicates ambulatory patients. Black indicates dead and moribund patients. And the answer is blue indicates ambulatory patients. Which one of the following services should ideally form the base of the health service pyramid? Clinical preventive services. B. Population based healthcare services. Secondary healthcare services. Tertiary healthcare. And the answer is population based healthcare services. Under Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, how much cover per family per year is provided for secondary and tertiary care hospitalization? 2 lakhs, 5 lakhs, 7 lakhs, 10 lakhs. And the answer is 5 lakhs. Discouraging children from adopting harmful lifestyles for the prevention of non-communicable disease is an example of primordial prevention, primary prevention, secondary prevention, tertiary prevention. And the answer is primordial prevention. Screening of a subgroup population for a particular disease is called mass screening, selective screening, high risk screening, multiphasic screening. And the answer is mass screening. Which one of the following is the indicator of prevalence of contraceptive practice in the community? Total fertility rate, general fertility rate, couple protection rate, net production rate. And the answer is couple protection rate. Which one of the following occupational diseases occurs due to sugarcane dust? Anthracosis, silicosis, farmer's lung, bagosis. And the answer is bagosis. Which one of the following vaccines is sensitive to freezing and should be protected from sub-zero temperature? Oral polio, BCG, Japanese encephalitis, cholera. And the answer is Japanese encephalitis. Peyer's patches are present in stomach, duodenum, jejunum, ileum. And the answer is duodenum. The type of joints where movement takes place about a single stationary axis and is largely restricted to one plane are known as plane joints, hinge joints, ellipsoid joints, saddle joints. And the answer is hinge joints. The most appropriate data collection tool to measure attitude towards condom use would be checklist, Q-sorts, Wignet's, Likert scale. And the answer is Likert scale. When one chooses a course of action from several options based on criterion, based on regulations of institution and professional standards, this problem is called problem solving, decision making, diagnostic reasoning, hypothesizing a solution. And the answer is decision making. A report of any event that is not consistent with the routine of hospital and is written only if any mishap or mistake occurs in the patient care is called compliance report, handoff report, incident report, clinical information report. And the answer is incident report. Study to assess motivation, focused intervention, effect on self-esteem of adolescent in a school. In this, what type of variable is motivation focused intervention in the statement given above? Confounding, independent, dependent, extraneous. And the answer is independent. A researcher conducted a study to describe the live experiences of caregivers of patients with dementia. Which type of qualitative study is conducted by the researcher? Ethnography, phenomenology, case study, grounded theory. And the answer is phenomenology. Approach to reliability assessment that involves administration of the same measure to the same people on two occasions is called inter-rater reliability, test-retest reliability, intra-rater reliability, parallel test reliability. And the answer is test-retest reliability. 26 years old woman visiting gynecology OPD complains of creamy vaginal discharge with fishy odor. There is no history of itching. The possible diagnosis of the patient is candidiasis, chlamydial infection, bacterial vaginosis, leukoderma. And the answer is bacterial vaginosis. Daily requirement of calcium during pregnancy and lactation is 500 to 100,000 milligrams, 1 to 1.5 milligrams, 1.5 to 2 grams, more than 2 grams. And the answer is 500 to 1000 milligrams. Presence of functioning endometriums in sites other than uterine mucosa is uterine polyps, adenomyosis, Paget's disease, endometriosis. And the answer is adenomyosis. Which one of the following is a non-steroidal compound with potent anti-estrogenic properties used for oral contraception? Progestin only pill, levonorgestrel, desogestrel, centroman. And the answer is centroman. Active management of third stage of labor includes administration of oxytocin 10 units, Krebs expression of the placenta, administration of carboprost IM, administration of misoprostol 1000 micrograms per rectum. Here I kept Krebs expression, but the answer is administration of oxytocin 10 units IM. All of the following are the causes of secondary dysmenorrhea except endometriosis, adenomyosis, bicornuate uterus, pelvic adhesions. And the answer is pelvic adhesions. The withdrawal and inability to initiate and persist in goal-directed activity is called apathy, anhedonia, avoidance, of avolition. And the answer is avolition. The most important and effective strategy for the elderly to maintain self-esteem and support the natural healing process of life review is bibliotherapy, token economy, reminiscence, milieu therapy. And the answer is milieu therapy. The psychopharmacological drug classification of olanzapine is typical antipsychotic, atypical antipsychotic, antidepressant, mood stabilizer. And the answer is it is a atypical antipsychotic. While assessing the patient, nurse asks the patient, if a house were on fire, what would you do? Which one of the following is being assessed by the nurse by asking that question? A. Test judgment, B. Social judgment, C. Insight, D. Abstract thinking. And the answer is social judgment. A temporary placement of nurses in a ward for 12 hours or less, which is done to cover the shortage of nurses, especially during evening and night shifts by the supervisor, is called intradepartmental deployment, interdepartmental deployment, interlocation deployment, short-term deployment. And the answer is short-term deployment. All of the following are techniques of inventory control except ABC, VED, XYZ, SDX. And the answer is SDX analysis. In the neonates, the brown fat is located at the following sites except around the heart, in the axilla, around the brain, around the kidney. And the answer is in the axilla. The normal respiratory rate of a newborn is 14 to 18 breaths per minute, 30 to 60 breaths per minute, 50 to 70 breaths per minute, 20 to 30 breaths per minute. And the answer is 30 to 60 breaths per minute. A persistent rise in PCO2 and decrease in pH level in newborn is indicative of metabolic acidosis, respiratory alkalosis, metabolic alkalosis. And the answer is respiratory acidosis. Classical symptom of invasive cervical cancer is hematuria, back pain, postcoital bleeding, anemia. And the answer is back pain. The irregular overlapping of the cranial bones on one another due to liquefaction of the brain matter of fetus is called Jacquemus sign, Spalding sign, Piscax sign, Rober's sign. And the answer is Spalding sign. Which one of the following is a measure of overall disease burden expressed as a number of years lost due to ill health, disability, or early death. Health adjusted life expectancy, quality adjusted life years, disability free life expectancy, disability adjusted life years. And the answer is disability adjusted life years. Numerator for calculating neonatal mortality rate is neonatal deaths within 28 days of life, 45 days of life, 75 days of life, 90 days of life. And the answer is 28 days of life. Which one of the following drugs used for treatment of malaria is contraindicated in pregnancy? Chloroquine, primequine, quinine, sulfadoxine, pyrimethamine. And the answer is primequine. So in this video almost 85 questions are there, and the remaining questions will be uploaded in the next video. So please subscribe, like and share.